Dear colleagues, welcome to the Day 3 roundup of ASCO23 brought to you by OncoAlert. No better way to start off than with the much anticipated ADORA trial with a concomitant New England publication. Key findings from the updated ADORA analysis reveal significant advancements in the treatment of lung cancer. The ADORA trial examined the efficacy of osimertinib, a third-generation EGFR inhibitor, as adjuvant therapy for completely resected lung cancer. The study demonstrated the ability to use targeted therapies at the earliest stages of lung cancer, resulting in remarkable outcomes. The survival data presented at ASCO23 showed a 51% improvement in overall survival for patients with stage 1B to 3A disease. These findings emphasize the importance of EGFR mutation profiling and personalized therapy selection. Ongoing studies are exploring the use of osimertinib in earlier disease stages and integrating it with chemoradiation. Additionally, utilizing biological markers and analyzing tumor-informed DNA in blood samples holds potential for further improving treatment outcomes. Following with prostate cancer, the TALAPRO trial, a phase 3 study demonstrating that adding talazoparib to enzalutamide as a first-line treatment for metastatic castration-resistant prostate cancer with HR deficiency yielded significant benefits. The trial successfully met its primary endpoint by showing a 55% reduction in risk of disease progression or death when talazoparib was combined with enzalutamide. Notably, patients with BRCA1/2 mutations experienced the greatest advantages. The combination therapy not only improved radiographic progression-free survival, but also resulted in notable delays in prostate-specific antigen progression, time to cytotoxic chemotherapy, and quality of life deterioration. However, it is important to consider that addition of talazoparib was associated with a marked increase in cytopenias, particularly anemias. Despite this drawback, the results of the trial highlight the significant progress made in the treatment of metastatic castration-resistant prostate cancer with HR deficiency by combining PARP inhibitors with an androgen receptor pathway inhibitor. Patients with BRCA alterations in particular benefited greatly from the combination therapy. Nonetheless, further research is needed to determine the optimal sequence of therapies and to evaluate the benefits for patients who have received previous treatments or have rare DNA alterations. Moving on to rectal cancer, presented data from the PROSPECT trial, a randomized phase 3 non-inferiority study which compared two treatment strategies for locally advanced rectal cancer. The trial showed that neoadjuvant FOLFOX with selective use of 5-FU chemoradiotherapy was just as effective as 5-FU CRT alone in terms of disease-free survival and overall survival rates at 5 years. The study demonstrated that either treatment option could be used, giving patients the opportunity to choose the approach that suits them best. The trial also integrated patient-reported safety data, providing insights into treatment-related toxicities. The study had limitations such as limited diversity in participant representation and the exclusion of patients with high-risk tumors requiring radiation. However, the availability of multiple treatment options empowers patients, allowing them to tailor their therapy based on factors like access to radiation, fertility, preservation, and side effect profiles. The results of the trial have been published, and further analysis is planned to identify predictive characteristics for treatment response and to explore personalized therapies. Now onto gliomas, the INDIGO trial shows that targeting IDH mutation with vorasidenib significantly delayed tumor growth and reduced the needs for toxic therapies. These findings have implications for investigating targeted therapies in gliomas and other brain cancer. The success of the INDIGO trial is attributed to the focus on early intervention, conducting a single-agent placebo-controlled trial during the watch and wait period before radiation and chemotherapy. This allowed for a clear signal of drug activity. The trial design differs from others that focus on recurrent disease or combination therapies, and it also opens the door to drug development in low-grade gliomas, which previously lacked clear drug targets. And that's it, folks. Just some of our picks for the top trials from yesterday. Wishing you a wonderful day 4 at ASCO. Enjoy Chicago.